My primary goal as a midwife is to be able to provide the information so that this mom can make her own choices. This is her life, this is her baby, this is her birth, and it is not mine. That's paramount for me, is to make sure that we have all of the relevant information that we can provide her with so that she can choose what's best for her and her life.
We don't tell women what to do. We can give our bias or our comfort level or what we would do or what we would recommend. We can say those things, but ultimately it is the woman's choice, and that has to be respected. And when it is, you have safe, satisfying, normal births or better outcomes.
I feel like one of the biggest failings in the modern OB maternity care system is just doing things to people as a matter of course and not taking the opportunity to allow them to work through it by themselves. Because when they leave your care, they have a lifetime of decision making that they need to be facile with. And what better training ground than prenatal care?
Being a parent is going to be a constant series of decisions to make. How you give birth, who you give birth with, how you deal with complications during the birth or decisions during the birth. That's just the beginning for you.
I am a midwife.
I am a midwife.
I am a midwife.
I am a midwife.
Midwifery care is based on shared decision making.
Making sure that all parties involved are informed enough to make adequate decisions when those decisions need to be made, and that no particular component or person is left out of that decision.
Families who want to direct their own care, who want to have choice, who want to take on that responsibility of the decisions they make, are generally the ones who choose home birth or midwifery births in whatever setting. They want to be part of that decision making. They don't want it handed off to someone else and then they deal with the consequences of it. They want to share, to participate, and that's what makes them walk away feeling that the birth was their choice. And it is. It always should be.
And women who have complicated births don't have to have disempowered births, and that part of that is the planned decision making, that they feel like, okay, this is not going the way that I initially planned, but I'm part of the process of deciding what we're going to do about that. That to me is the key to midwifery care, is to really empowering women.
So the way that I work with my clients is with something called informed consent. And really what that's about is giving the client information. I call them arming them with information. And we're seeing each other time and time again throughout the prenatal care. All of that time, they're asking questions, I'm asking them questions, we're giving them information so that way by the time we get to the birth, they are armed with information. And so if something comes up, I'm going to continue to facilitate that conversation. Here's what I see, here's what we can do about it at home, here's the pros and cons of staying at home, here's what the hospital has to offer. And then they ultimately get to decide what is right, what's the right decision for them at the moment. It's a lot of responsibility for a parent to work that way, but it's very empowering and it's an important step in becoming a parent.
Small decisions, big decisions, they all have to be, I think, approached with that model of informed choice. It sort of connects with continuity of care. You can't really separate the two because it's getting to know each other that enables the woman to feel that she can make that choice.
I think one of the most important aspects of maternity care is women's autonomy, being able to have true informed consent or informed refusal, to understand the risks and the benefits of every medication, procedure, intervention, including doing nothing. And to be able to have that autonomy.
One of the things that really makes care safe, whether it be midwifery or obstetrical, for mothers and babies is good interprofessional collaboration and care. So good communication, positive relationships, smooth transfers of care.
A midwifery service really can't exist without some kind of backup, be it a hospital service or a home birth service, because there are going to be women who need cesarean sections, and there are going to be emergencies that need the care of OBGYN doctors. And so we all have to have some plan for that collaboration. Ideally, that really involves a relationship between the midwife and the collaborative physician.
Having that already a relationship established with anybody that you might need to work with. That includes social workers, psychologists, lactation consultants as well. All of these people are people who are surrounding the mother and baby and promoting their health, enabling mothers to feel supported, encouraged, and able to make decisions and have those decisions be respected.
What can happen between a very well-informed physician and a very skilled and adept midwife is a phenomenal symphony of a birth that could just really take care of a lot of the disparities. Each one of the trades aren't mutually exclusive, but rather interdependent. Midwives are very keen and knowledgeable about catching things early enough to do a preventative healthcare model, whereas most physicians are trained to be prepared for a complication. The doctors that can catch that and start to see the value of midwives, that will be the doctor that can change the world in birth.
I am a midwife.
I'm a midwife.
I am a midwife.
I am a midwife.